is?
Myelin.
Myelin.
It's a mus.
No.
Oh, it's isn't that what like that insulated?
It's the insulation. Remember the neurons have that insulation around their axon, made up of either Schwann cells or oligodendroglial cells. Remember this? So multiple sclerosis is a demyelination disease. This is an autoimmune disease where the immune system is making a mistake and it is unfortunately destroying that insulation, which means the signal never gets from here to there, never gets down to the muscle. Multiple sclerosis. So we're going to flip through some of these things kind of quickly. Poliomyelitis, caused by the poliovirus. This causes paralysis. It could include paralysis of the diaphragm, which would cause death. This is something that is still around in the world, but not in the United States, thankfully. We haven't seen it in a long time. Very easily transmitted from contaminated water, for instance. There was a time people thought it came from eating ice cream.
Wow.
They were wrong. I mean, that's way off. That's like thinking that you get, I don't know, any other disease. That's like if you thought you got HIV from eating ice cream. That's just how wrong they were. But then again, they've been wrong about things in the past, haven't they? Yes.
You might think this is a stupid question, but you can't get, like, I think STD from sitting on a toilet seat. Like,
Me?
well, a
Do
girl,
you?
A
like
person?
sitting, like a girl sitting on, because I hear so many girls saying that, they're like, yeah, I got syphilis from sitting on the freaking, toilet seat. But I was like, I hear a lot of people say it's not true.
He was sitting on there first though.
Because first of all,
She was sitting on him while he was sitting on top.
the mucosal membrane would have to come in contact with the toilet seat, which should not happen at all.
I thought, I never looked it up, but I didn't sound right, like, how do you get it?
No, they don't.
Like, are you
They don't.
rubbing, or?
Yeah, exactly. They don't. And that means somebody else would have to rub, and then they would have to rub,
Right.
and that would be odd.
I was just like,
So no, that's not going to happen.
Even stuff
And even then,
But why do people believe that? Like, why?
because they want to. Because they want to believe that their boyfriend didn't cheat on them.
Mm-hmm.
They want to believe that they didn't cheat on their boyfriend. They didn't get it from messing around. And then somebody wants to believe that they're being honest. And they're not. Now, does that mean that toilet seats are clean? No, there's a bunch of bad things on toilet seats. Mostly in the form of like E. coli and enterococci, bacteria from the bum, in other words, as well as Staphylococcus aureus. So if somebody has an open staph infection or a staph infection on their leg, they sit on their bum, they sit on a toilet seat, they leave some of that staph behind, and then somebody else sits down on it with an abrasion or something where the bacteria can get it, then yeah, they can get an infection from that, but it's not sexually transmitted infections, it would be bacterial staph infections. So I'm not suggesting that you do not use a little paper thing between you and the toilet seat, you know, those little tear off paper things?
Yeah.
Yeah, still use that, either that or carry around a little thing of bleach with you and spray it down first.
That's what I used to do. I used to do that. I do not smell toilet seats.
Okay, that's a lot of information. Thank you. Oh wait, amyotrophic lateral sclerosis, ALS, this is Lou Gehrig's disease. Talked about that a little bit. We're not gonna talk about those neuropathies. No. Oh, this is a good term. Here we go. We know what congenital means, right? Okay. Congenital means it's present at birth, right? So this one is a good term to hear about, a teratogen. A teratogen is something that's going to cause birth defects. Like certain medications are teratogenic. In other words, they're known to cause birth defects. X-rays are teratogenic.
Alcohol.
Alcohol. Yes. So that's just a good term to know. Teratogen means it can cause birth, it'll cause birth defects. FYI. And we talked about some of that stuff. Spina bifida. This is spina bifida. This is when, remember this?
Rubbed together, right?
No, actually. You know, the spinal cord goes down through here?
Yeah.
Spina bifida is when there's an opening here.
Okay.
And
So it's
either
not-
the layers, remember the meninges that go around, is either protruding through or the spinal cord is protruding through. Which you can understand why that could be dangerous, right? Because then it's lost that protection all the way around. You don't want that.
Dang, can you fix it? Can you cure it?
Cure it, no.
You can
Fix it, you can stabilize it.
What's the consequences of having spina bifida?
Paralysis,
Also, these people who are paralyzed?
there could be. But this is something that is they're born with. We'll talk about cerebral palsy. I was gonna talk about those. It's not gonna talk about those, we talked a little bit about that already. This is where I wanted to get to. I'll do something interesting today. The crazies.
Me.
Yes. But me as well. And you, and you, and you, and you, and you. Because there's a little bit of crazy in all of us.
Yes, I love mental health.
I know, everybody loves talking about this. I'm really glad it's included too, because I like talking about it, because I think it's important. I think it's important that people realize it's a part of medicine. And I also think it's important to realize that every one of us is a little bit crazy, by definition. Because the book of crazy is called the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or also known as the DSM-5. The Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, which is exciting because just a few years ago it was the DSM-4, about 2 years ago, I think. And it was the DSM-4 for as long as I can remember, so. It lists every sort of mental condition there is. And there's a lot. So this is a book that's this thing. This is the Handbook of Psychiatrists, the DSM-5. You ready? We're gonna start into this. We're gonna start off with this part here. What does psycho mean?
Mine.
Mind. So what is psychology?
Study of the
Study of
mind.
the mind.
Study of the mind. So what is psychiatry?
The study of,
It's not a study of
I know.
I think it's the treatment.
Psychiatry is, yeah, the treatment.
medical treatment.
Yeah.
It's the medical treatment.
Treatment.
So tell me, medical treatment.
Medical treatment of the mind.
So tell me, what is the difference between a psychiatrist and a psychologist?
A psychologist studies the mind.
Okay,
And what you say, the other word?
you said the other, psychiatrist.
Psychiatrist is the one who treats them.
You
How
can
treats it
administer
how?
medication.
What's medicine?
Medically treats it. Because people often confuse these when I ask them what's the difference between a psychiatrist and a psychologist, they just say psychiatrists can give drugs. Well, that's because a psychiatrist is a medical doctor, because they do medical treatment. It's right there in the name, medical treatment of the mind. Whereas all these people do is what?
Study it.
All they do is study it. That's why they're not medical doctors. They can have a PhD in psychology, but they're still just studying it. They're not treating it. And the thing about the mind is we don't really understand how it works, do we? We do not. So if we don't understand how it works, do we know how to fix it?
No.
We do not. So when a person has one of these crazies that we all have, the job of the treatment, medical treatment, is to get the person to their highest level of functioning and then maintain that level. So psychiatrists don't necessarily expect to cure a patient. They expect them to get them functioning at their best possible level and then maintain that. Oh. I know, it's exciting. All right, let's look at these mood disorders. The first one here is what? Major depression. What does a major depression mean?
A large depression.
A large depression, like a big open area in the ground is a major depression. You could jump over it, you could walk around it, you could, oh, that's a different lecture.
I would say maybe it's like a constant ongoing depression
Constant,
versus
ongoing, okay.
like where you get bad days.
You get, okay, you're right. A lot of times I've had young people say to me, I have depression, and the first thing I ask them is, what do you do for fun?
Lay on the
Do
couch.
you go out with your friends?
No.
Well, yeah, sometimes.
I don't have friends.
Oh, your stories make me sad. Do you go out with your family? Do you go to the movies sometimes? Do you go out to the club sometimes? Do you laugh? And they say, yeah, sometimes. Well, then you don't have depression. Because with depression comes what we call anhedonia. And anhedonia is without having any sort of pleasure in any activity. So, no, that's not depression. Usually what it comes down to is their life sucks. Welcome to the world. They're like, because I don't have enough money to pay my rent. Yeah, life sucks. I don't have enough money to get a car. Yeah, life sucks. My engine light came on in my car and it stopped running. Yeah, life sucks. My boyfriend broke up with me. Again,
You did?
he did. Life sucks. Or my girlfriend broke up with me. Yeah, life sucks.
That's great.
Dog died. Yeah, life sucks. So what you usually find is not people with depression, like true depression. What you find is people who are having bad days, as you say. And if you say to them something like, what if you won the lottery? They would make that sound. Maybe a little louder, but they would make that sound. $280 million. Really? That's all I get? I have a feeling that many of those people wouldn't be so depressed suddenly because so much of their problems revolve around money. Are they still going to have relationships problems? Of course they are. You know why? Because we're humans. We all have relationship problems unless we're not in a relationship.
Yes.
No problem. So when we diagnose somebody with a major depressive disorder, we have to rule things out. What if their spouse just died? What if their child just died? Are they going to be depressed?
Yeah.
Of course they are. For how long?
Who knows? Who
Not
knows?
for- Oh, I know.
No.
Yes.
No.
Yes.
No.
Yes.
No.
Thank you, doctor, but you're wrong. Yes.
Everybody's different.
No.
Okay.
No, we have. No, listen to this. Stop saying no. Okay, listen to this. This is real life. This isn't Facebook life. Real life is we have to put a number on this. We have to say, how long is this person going to have depression? And remember, what does depression mean? Depression means anhedonia, that they find no pleasure in any activity. People don't go through their entire life when their child dies, never having pleasure in any activity, unless they have true depression, which means it would have been there anyway. No, we have to rule things out like that. So if a person's loved one just died, well then, yeah, they're going to be depressed. We expect that depression to last 6 months. If it goes beyond 6 months, then it's no longer the result of the death. Then we could say this is a true depressive disorder. You see, what you're confusing is the fact that, are you still going to be sad once a year when the birthday rolls around? Of course you are. Are you going to be sad at Christmas time? Of course you are. Are you going to be sad on the day of the anniversary? Of course you are. I didn't say you don't feel sadness ever. I said depression. And depression means anhedonia. They don't find any pleasure in any activity. Every one of us has had someone in our life that we've lost, or several people in our lives that we've lost. And it was bad, and it was sad, and it was bad, and it was sad. But then months go by, and we find ourselves watching a movie and laughing again, and having fun with friends again, and having fun with family again. I know. Otherwise, it would be considered a depressive disorder.
So how common is major depression then? If everybody's really depressed?
It's not, because that's acute. That's just an acute depressive state because of a loss. And people can be depressed for a lot of reasons. They can lose their job. And I don't mean the job they started at Walmart 2 weeks ago and they got fired. I mean their career. They've been working someplace for 15 years, place shuts down. They have no other skills other than what they've been doing for the past 15 years. And now they lost all their benefits. Now their house is getting foreclosed upon. Yeah, that can all cause depression and sadness, but that doesn't cause a depressive disorder. A depressive disorder is up here all the time.
So depressive disorder,
Well, I'm sorry?
Like if they work for the government, but they didn't lose their job, but they weren't getting paid.
Well, it depends on who you meet.
The people that weren't getting paid and they were getting, and they weren't able to like pay their mortgage or stuff.
Get food, stuff like that.
Well, it depends on who you meet in the government, because there was lots of people who worked for the government who still paid their mortgage and who still got food and stuff. Lots of people, in fact, the majority of them. There was only a minority of people who worked for the government who didn't get food and weren't able to pay a mortgage for a month or two.
No.
And the reality is, in a lot of the, or the rent, and the reality is in a lot of those cases, people would find relief in other ways. Sometimes they would get like a, that's what I'm looking for. Like the landlord would say, okay, don't worry, get it next month. Because you know the check's coming.
Yeah.
It's not like they're not gonna get zero money. They just didn't get it right now. It's not like they missed those paychecks. It'll catch up. But think about the senators and congressmen. They work for the government.
Yeah.
You think they went without eating? You think their mortgage suddenly didn't get paid? No. Why is that?
because they
Because
said
they
they
make
had
enough.
more money.
They had more money. They had savings.
Yeah, they were smart.
Well, here's the problem though. When people get a lot of these jobs where they're working for the government, they do make considerably more money. So the idea is, if you get a job where you're making considerably more money,
Who cares?
you take some of that money and you put it into an account for when you do have time off.
Rainy day.
The rainy day fund, yes.
We taking a break?
Is it break time?
I don't know.
Since I'm on a bipolar disorder, this is a term that people confuse a lot. They think that Dr. Sturgeon was in a good mood this morning, and now he's in a bad mood, not be bipolar, or somebody's happy one moment and sad the next, that's bipolar. That's not what bipolar looks like. Now, there are degrees of bipolar, but a true bipolar disorder used to be called a manic depressive disorder, because a person would have an episode of mania, which is a highly happy state. That's not the word.
My grandma.
Extremely happy, like they'll call you up at 3 o'clock in the morning and tell you their plans to start an amusement park on a Caribbean island. It'll be bigger than Disney World, and they'll start talking about how they're gonna sell off their belongings and take the money and go to Atlantic City and win a bunch of money at the casino, and then take that money and buy a boat and start building their dream amusement park on this island. They'll be up all night making meals for the week in advance, or 2 weeks in advance, or the month in advance. They're extremely happy, and this will go on for days and weeks at this elevated state. And then it'll crash. And then they'll be in a depressive state, which means anhedonia. They're in their room, in their home, curtains drawn, hardly eating, not showering. Be down here. And that could go on for days or weeks at a time. So, to diagnose a bipolar disorder, we don't even need the depressive state. All we need to see is that mania. When you get that really, really excited state, we know the next part's gonna come. Now, in treating these disorders, any of these disorders, understand that we're gonna treat those chemicals that are coming across that synapse, that space from neuron to neuron. So we're either gonna stop too much from coming, or increase the amount that's coming, or increase the amount that stays in that place, or block the receptors from too much of the stuff coming, whatever the neurotransmitter happens to be. And the brain gets used to it. In other words, it becomes sensitized to these things. This is why it's very, very common. You'll find people who are on these types of medications for anxiety or depression or bipolar, they often have to change their medication or change the dosages.
Yeah,
Because it never works the same forever. It's not like Lipitor or something, a person can take the same dose for just a long period of time and it always works. This is something that always sort of fluctuates. Because remember, the idea of the psychiatrist is to get the person their highest level of functioning and maintain that level. So if we see any fluctuations, we have to start thinking, okay, is it because they're not taking their medication, is it because their medication isn't doing the job anymore?
So, someone with that disorder, will they get like antidepressant?
a mood stabilizer.
Food stabilizers. And lithium actually is still a great drug of choice for bipolar disorder, but it's a very narrow therapeutic window, which is dangerous.
What's,
Xanax.
so,
And it's something,
like that, so what antidepressant?
Zoloft.
What is,
sort of more, Xanax more for anxiety.
What was the one that everybody used to take?
Valium was popular for a while.
Volume and,
Oh, yeah.
I forget the other one. But I have a question. Why is it that most of those, disorders are like also related to other, like brain function?
We often find when people have mental disorders of these types, they often have some other one as well.
Yeah, that's what I was
Yeah,
saying.
it's usually just because the same neurotransmitters that are used in one area are used in another. But it could just be, somebody who has heart disease can also have arthritis.
so what would be the job of the antidepressant? Like, what does it do?
Again, it depends on the type, but everything that we do with those medications, remember I said, we have the neuron here that sends an electrical current, becomes a chemical signal, becomes an electrical current again. Every kind of medication we do works at that synapse. It either blocks the receptors, so that there's a lot of this neurotransmitter coming across that we don't want. It blocks the receptors, so it doesn't even know it's there. Or if we want to have a neurotransmitter that's coming across in low amounts, we can keep it in that space, sort of the same way we did with the myasthenia gravis drug, where we block the acetylcholinesterase. We can block we call them reuptake enzymes that would normally recycle that neurotransmitter. If we block that, that keeps it in the space longer, which means it would be as if the neuron released more neurotransmitter than it actually did.
Okay.
So all the medication that we give always function in that area. None of them change the anatomy. In other words, it doesn't change how much suddenly this neuron is going to be programmed to send out. It doesn't do that.
Because I suffer from chronic tension. And they gave me, I was trying to think of the name of the medication, but it's an antidepressant. And I'm like, why would y'all give me that?
It could work for the same thing. Could work. Could work for more than one.
With this, I always had a thing with mood disorders because people don't want you to be happy or sad. Like, they don't want you to be sad at all, ever. Like, somebody would be like, oh, you have a mood disorder, or there is a mood disorder because of life itself. Like, it's almost like
I was talking about that earlier.
we're programmed to not want to feel emotion.
Yeah.
And I think that's the craziest thing. Like, if somebody punches you in your face, you just want to be like, hi.
Right.
That's weird to me.
It is, and there's natural reactions, and then there's unnatural or overreactions or underreactions. And those are the things that get fixed, or at least attempt to get fixed. Because sometimes people will just not do anything, but the person will go off as if the person was hit him in the face. That sort of anger. Or you can see sometimes, like with schizophrenia, you can see this blank affect for this person's face, the facial expression doesn't change. You can tell them, hey, you just won the lottery, and they say, oh, okay. And you say, but also your family just died in a plane crash, and they say, oh, okay.
Someone has schizophrenia.
That's a blank affect. That's one of the components of schizophrenia. That doesn't mean that everybody who does that has schizophrenia, but it's one of the components. So yeah, mood disorders, obviously, they get talked about a lot. Generalized anxiety disorder. This is what we call the what if disorder. What if I lose my job? What if my wife leaves me? What if all of my friends unfriend me from my Instagram, whatever you guys do? But it's always bad. It's always bad what ifs. It's never a good what if, like what if I won the lottery, or what if I married a supermodel? It's never a good what if. And the thing about this what if disorder is that it occupies their mind all of the time. So how do you concentrate on your education, on your schooling, when this is always on your mind? How do you concentrate at work when this is always on your mind? That's what makes it difficult.
What if?
The what ifs. Yeah, the what ifs.
So why with anxiety, it's such a, feel like panic.
We're not there yet.
Oh, okay.
We're on the generalized anxiety disorder.
Oh.
That's the what ifs. Have you heard of post-traumatic stress disorder?
Yes.
Yes, 85% of this region has it.
PTSD. What constitutes post-traumatic stress disorder?
Trauma.
Or trauma.
Well, we've all had trauma. Many of us have, especially as we get older.
Being incarcerated.
I'm sorry?
Being incarcerated.
That can, war,
Well, it's not just going to war. Just going to war doesn't
it's
constitute
reliving it
PTSD.
over and over again.
Right. The PTSD part is having gone through a traumatic event and reliving it over and over to the extent that it interferes with your life. I remember those times when I was in battle and it was rough and we had terrible times and it was a horrible experience. And then that's it. Post-traumatic stress disorder means this stuff rules your life. That traumatic event rules your life. And that's unfair to you. That's unfair to the patient for them to have to live through that over and over and over again. But it does. It used to be called combat fatigue for a reason. See, combat.
That was what, Vietnam?
Oh, pre that,
Pre-Vietnam?
oh my gosh, yes, World War I.
Right
We're
now
talking
they're
about combat fatigue.
locking people up and diagnosing them with PTSD.
You should have seen the people who, post World War I, the asylums they would be put in. They were horrible. And, a lot of people were put into those asylums with real crazy people, and they weren't crazy. So if you get locked away and treated like a crazy person along with a lot of other crazy people, it's gonna wear on you, that's for
Why
sure,
didn't they
yes.
just do that brain? What were they doing back then, at that time?
Lobotomy, that didn't happen until the 1930s.
Oh, so like.
What was his name, the lobotomist? Oh, I can't think of his name. He created a way to cut in through this way and use a leucotome, which is like looks like a big butter knife really, just slice through part of the frontal lobe of the brain. But then he perfected this procedure by getting an instrument that looked similar to an ice pick. And the patient would undergo a shock therapy. This would be the anesthesia that they would use. And then they would get the ice pick and just go right by the eyeball, sort of move the eyeball out of the way, get a hammer, and pound the ice pick in and just scramble that part of the frontal lobe. And that would hopefully cure them of their mental disorder. Hopefully.
And,
Their success rate was 1/3 of the patients got better, 1/3 of the patients stayed the same, and 1/3 of the patients got worse. Or as I'd say, 1/3 of the patients got worse, 1/3 of the patients saw no improvement whatsoever, and only 1/3 got better. But it was incredibly risky because it was messing with destroying part of the brain. So 2/3 of the time, nothing happened or it got worse, in my mind at least. So this is a practice that was used for quite a while. I can't think of the guy's name, it's right on the tip of my tongue. And the thing about this is, it was used for a lot of things. It wasn't just used for like somebody with schizophrenia. They would take children that we would now consider to have something like ADHD is what we would call it today. You know, they're being a little rambunctious in their youth, and they would take them, even though there were medications at the time, an option was to scramble part of the frontal lobe of the brain.
Was it Walter Freeman?
That's the one. Freeman or Friedman?
It says Freeman.
With a D?
No.
Freeman.
Free.
Walter Freeman, the lobotomist. Yeah, he was the guy who started this. Needless to say, we don't do frontal lobe lobotomies anymore.
Right.
That's part of a history that should remain quiet. They just didn't know what else to do, I guess. But imagine that. Imagine having your child with something that was similar to an ADHD today, and thinking one of the ways to fix this would be to scramble his brain with an ice pick.
Or gay, wasn't it like gay also, they would do it,
Oh, it was, yeah, because that was considered a mental disorder.
mental disorder,
Oh, if you were gay.
yeah. So they would send you to the asylum.
Oh, every they're killing these.
Have you heard of a panic disorder? I'm sure you've heard of a panic attack,
I
right?
heard of a panic attack.
Well, panic attack is the physical experience the person has. And they'll tell you that it feels like they're having a heart attack. They'll say they have difficulty breathing. They'll say it feels like the world's coming to an end.
And that was.
It feels like they have chest pain. And that is based on anxiety. And when they come into the hospital, how are they treated? They come into the emergency room with these complaints. As a heart attack, of course, we're gonna treat it like a heart attack. But we're also gonna draw blood, just like we would with a heart attack. We're gonna look for cardiac enzymes. Cardiac enzymes would only be in the blood if some of the heart was damaged. If the heart isn't damaged, as like would happen in a heart attack, well, there's not gonna be any cardiac enzymes in the blood. There's no cardiac enzymes in the blood, and this wasn't a heart attack, then we can say it was a panic attack, which now they're diagnosed with a panic disorder. And the problem with this is, once the person's diagnosed having a panic disorder with this panic attack, the next time they feel this coming on, they're gonna think, oh God, I'm gonna have a panic attack, which causes them to have a panic attack. It's sort of a self-fulfilling prophecy.
Okay.
But the good news is they're not dying, they're not having a heart attack, but they certainly feel like it. Yes.
What would cause panic attacks, like blind sleeping?
Well, and you know what, here's the thing, I was just gonna get to this actually. If you ask the person, what triggered this? Were they thinking about the bills they had to pay? Were they thinking about the upcoming exams they have to take? Were they thinking about stress because of a marriage coming up or something, or a divorce coming up?
They don't know.
It's nothing to do with that. They'll say, no, I was in the shower thinking about nothing. I literally was thinking about nothing.
I
And
used
it
to
just
have,
happened.
I used to have panic attacks all the time. I went to the hospital because I was told I had heart problems, and I didn't. Like, they was just like, no, you got a panic attack, and they go, what were you doing? I'm like, nothing.
Well, we
So
have to
I'm
ask that.
panicking.
Yeah, we have to ask that because then we have to determine whether it was based on some manifestations of physical, real problem, or if not, well, then it's easily diagnosed as a panic
Yeah,
attack.
they don't do any. They didn't do anything for me though. They were just like, I'm trying to calm down. But, like, I never got medicine or anything. It's like
So would they be people that
What
get,
happens when you
like,
are,
they were supposed to give you medicine.
Yes, or
I don't
like
know.
values?
They would probably refer you to someone
do exercise.
to go to your
Psychiatrist.
practitioner.
Oh, yeah, they said the same thing, panic attacks, just try to calm down, blah, blah. Like, never medicine. I've
That's
never
good.
got Medicine.
I would prefer not to give medication for it if I could help it.
Yeah, I
So
just,
it's good.
like, I could be sitting in the classroom and I'm like, oh my gosh, I can't breathe, it just be like that, like, just like a crazy panic attack.
Okay, well, good, now I know.
No, I don't have
So if you do
it.
that, I'm gonna say,
No, I
stop
don't
it,
have
okay.
it, I don't have it, like, they don't have it to me.
What if it happens, like, what if panic attacks happen both ways? Like, sometimes like it was caused by a specific thing, and then other times you were just sitting there and,
Again, there doesn't have to be a trigger. But sometimes the trigger is the fact that they think they're gonna have a panic attack. Or sometimes the trigger is just a lot of anxiety over some specific cause. But if it happened one time over some specific cause, like the first time a person's ever had this happen to them,
oh,
and they're in the hospital, and I'm gonna ask them what was going on at the time, and they say, I just got a notice that I'm being evicted, and my significant other left the same day, and it was just overwhelming. Well, then I'm not gonna be so quick to label a panic attack. But if they came back again, or if they came back to the doctors again another time with something else, then it starts to say, okay, now I see the pattern. So it doesn't have to have a trigger, but it certainly can. Alright, let's talk about something fun. Phobias. What is a phobia?
a fear of.
It is, but understand, in medicine, we're talking about phobias, we're talking about an unreasonable fear. It's an unreasonable fear. So, if you're walking through the woods, and there is a rattlesnake on the path, right in front of you, coiled up, rattling its tail, and you go, I think I'm gonna go this way instead. That is a reasonable fear. That is not a phobia of snakes. However, if a person walks into a room where someone is watching a documentary on snakes and screams, runs out, pushes a child out of the way to get out of the room, then that's unreasonable. I call that ophidiophobia, the fear of snakes, ophidiophobia.
What about clams?
Don't ask me what a fear of everything in the world is, because I have no idea. There's a book this thick just on phobias. In fact, if there's a thing that exists on the planet, chances are somebody has an unreasonable fear.
Those people used to be on
So,
Maury.
Yeah,
what was your-
they mustard and
So
all
what was
that.
your question?
Clown.
I don't
Yeah, me too.
Unfortunately, those people that were on the Maury Povich show, Maury Povich show is a reality show, which means it's not real. So you have to understand that if those people had those,
Not all of it.
if those people had those fears of like pickles or aluminum foil,
They wouldn't even.
first of all, what you would not do is bring out a tray full of pickles or aluminum foil and stick it in their face. That is incredibly cruel to do. No, you would not. We are in health care. We care for people's health. So no, you would not do that. That's a cruel thing to do to people. Secondly, if you watch that show, at the end of the show, they usually had somebody like a hypnotist on or somebody who by the end of the show had them over their fear.
Is that
And at the end of the show, they're dancing around wearing aluminum foil hats and eating pickles. And the reality is that's not real. They're not gonna go from terror running off the stage to suddenly now not having a fear of it and being completely okay with it. It doesn't work like that. That's impossible.
Can a person really get hypnotized?
To certain extents, yes.
Oh,
Yeah.
Really?
About 80% of the people are capable of being hypnotized and being put.
I thought it was fake.
Yeah.
That was fake.
No, what's fake is when you see the TV shows, you see the people on stage at a fair or something, they say, we're gonna, take 10 people from the audience and bring them up on stage, to hypnotize everybody. And during the show, this one guy thinks he's a chicken who's walking around and somebody else thinks they're a quarterback.
Yeah.
Those are fake. Because what happens is, and the people are real, the people aren't like plants or anything, they're real. They get random people from the audience, especially the ones who are jumping up and down going, me. Because when you get 10 people backstage and you say to them, all right, we're gonna have some fun today. I'm gonna, pretend to hypnotize you and you're gonna pretend to be this and you're gonna pretend to be this. The thing is, if you get 10 people back there, all 10 are more likely to go along with it. If you got one person and you got them back there saying, okay, I'm just gonna have fun today, I'm gonna hypnotize you, make you think you're a goose. Person might go, yeah, I'm not gonna stand on the stage like an idiot looking like I'm a goose. But you get 10 people who are all excited, all wanna be a part of the show, then they're more likely to go along with it. So it's just entertainment, and it's funny, it's fun, but it's not real, that's not real.
Have you ever seen anyone hypnotized?
I've heard of people being hypnotized, I've not seen it in person. I've seen different specials, documentaries with medical doctors who have undergone hypnotism for pain relief,
Oh, okay.
and it does work to an extent, but it just puts a person in a hyper relaxed state and makes suggestions. So it does work for things like weight loss. It does work for things like smoking cessation. People want to stop smoking. And lately, this has been a trend over the past decade, maybe even not even that long. A lot of medical students and law students are using it to help them study, to help them stay focused for studying. I thought it was brilliant. If it had been around, if it was something back in my day, I probably would have tried it as well.
So if I was scared,
But-
because I am, if I was scared of flying, can I get hypnotized?
No. Not to that extent, no, not to where you're gonna go, okay, now put me on a plane. But you could certainly undergo some therapy that would make it easier.
Okay.
We'll talk about that in just a little bit. I want to talk about more of some of these. Have you heard of claustrophobia?
Yes.
What is claustrophobia mean?
Unreasonable fear of small space.
Fear of small spaces. Even people who don't think they're claustrophobic, if you put them in an MRI machine and that thing starts going do, 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 suddenly they start freaking out. Or they may have gone up and down their elevator in their building 100 times, never caused a problem, and then suddenly the elevator gets stuck between floors. Then they start feeling like, okay, now it feels like the walls are closing in. What's the next one? Acrophobia. Fear of heights.
That's me.
Now again, if it's your first day as a window washer and you're out on the 74th floor looking down going, this is kind of high, I think that's reasonable. But people with acrophobia won't even go into that building that has 74 floors. They won't go to the, beyond the third step on that ladder.
So what is it when you don't have that fear of being up there, but you still get that adrenaline rush? Is that natural to have that adrenaline rush when you get up to heights?
I would think so, yeah. I would think that
Roller
there's still,
coasters and
yeah,
stuff? That's normal, right?
I would think that's normal.
I get short of breath on the elevator, like at the hospital, at university, you know how you can see the outside?
Yeah.
Oh my God.
What is agoraphobia?
So that's what we do with death.
With what?
Death?
No.
Oh, spiders?
No, that's arachnophobia.
Agoraphobia.
Agoraphobia,
Fear
that's
of being trapped in public space.
public places.
Oh,
Yeah.
okay.
This, you never heard of agoraphobics? These are people who don't want to leave their house.
Oh, okay.
And for a long time, you would see these people at Walmart, at one of those 24-hour Walmarts, shopping at 1 o'clock in the morning, because they wanted to go when there weren't any people there, but they wanted to get all the bargains at reasonable prices that Walmart has to offer.
I think I have that.
Me too, I would
that
say,
too.
I could see how social.
So they're fearing to be in a public place?
No, antisocial is more about, socialization. And that means it doesn't have to be a crowd, it can be like just 2 people or 3 people. And you just don't want to spend any time with them, you don't want to interact with them. Agoraphobia doesn't mean you don't have to interact with anybody, it's just being part of that crowd, just being in that crowd, being surrounded by people.
So
Of
it's
course, now a lot of agoraphobics just order online.
So it doesn't have anything to do with being in a public place with people, it's just being in a public place, period?
No, with people.
With
Yeah.
people, okay.
So they cool with being around like 2 people?
They can be cool with being around 2 people, yes.
Oh, okay.
Agoraphobia.
I got that too.
Now, do they make an exception for family members?
Usually, yes, absolutely.
Oh, I didn't know.
Fear of public
Because
speaking
it's like, I
is,
know you.
or anybody they're introduced to by their family members.
Okay.
But, the fear of public speaking is the most common fear among people.
Why?
I don't know. More people are afraid to speak in public than they are of death.
Judgment.
I would think just people looking at you.
Yeah.
Like, do I got something?
But it's amazing because if you look at how many people now post things on YouTube and have all these different friends on your face channels
That gives me high
Because
anxiety.
that's fraudulent.
and these are people that you don't know, but you're posting pictures of yourselves, videos even,
You don't have to look at them face to face.
but it's a face to face.
You're seeing people's reactions and
That's an acceptance. Oh. Like, I gotta be accepted. It's not.
You are not. You're fine, you're wonderful, you're having a Christmas morning. Arachnophobia,
That's
the
nature.
stuff that dreams from me. Spiders,
I definitely fear.
arachnophobia. And again, we're talking about unreasonable fear.
Like afraid of the bugs on your eyelashes type of unreasonable.
Yeah,
Yeah. Uh-huh.
that's not unreasonable, that thing was made. An unreasonable fear would
Wait,
be,
is it called girlfriend? Wait, did you say that?
Afraid of the bugs on your
Again,
eyelashes.
You
He made her kill it.
you made
Yeah.
it?
it was a tarantula, that's different. But somebody who has a little spider walking across the windshield of their car and suddenly swerves over 3 lanes of traffic,
Oh, my mom.
Yeah. I stopped my car.
or
Crazy.
What? Did you make
It is spiders in people's cars. I don't mind.
I've seen spiders in people's cars.
You had yours too?
I don't know, like I probably had like a fly or something in mine, but I've seen spiders and like
One girl in people's cars, and she thought that kept coming through like the dashboard, like the windshield.
when there's something flying, it is
I
the
heard that's
worst.
from like sitting in a lot or
And
something.
it comes out and it's a whole
Ew.
big spider, and she starts screaming, she's like, you know, barking everywhere. I think one where a mouse came out,
Terrified.
a mouse came out of the thing, and they were like,
I saw a mouse go into someone's car in Philly. He came out of the grate, a big old one, and he just went into the person's tire well.
I'm sure that's a
Sat in there.
rat or a mouse, not a rat.
No, I think it was definitely a rat at that point.
yeah, I wanna know more.
You'll see a mother pushing a baby stroller with a baby in it, and a spider rolling up it, walking,
nope.
just a little tiny spider walking up, and she'll
Sorry,
push
bye
that
baby.
thing away from her. That's not good, that's incredibly dangerous, so
There's a
We
freeway
don't-
right across the street.
we don't
You
want,
gotta go.
we don't want that type of a phobia in people. So what we would do, sort of along the lines of what you were asking about earlier, a desensitization. So in that case with the spider, if I had a tarantula sitting in a terrarium over here, and somebody came over by the door and looked through the door and saw it and ran down the hall screaming, that's a bit of an overreaction. So in that case, what we would do is we get that type of a person to the point where we could get them standing in front of that door, looking through, looking at this, and being comfortable. Once we get them comfortable at that point, then we can open up the door.
Yeah, right there.
And then gradually, we'll start moving them over and over and over and over and closer, gradually. And even to the point where they could be standing right next to the terrarium and somebody could be holding a fake tarantula outside of the terrarium while they're looking at the real tarantula. And then maybe they could hold the fake tarantula while they're looking at the terrarium. And then somebody outside could be holding a real tarantula. And then eventually, they could be holding the real tarantula. Now, before you say nope, the reality is we know that will never get there. We know that person who was screaming down the hall because they saw something way over here, we know that person's never gonna be walking, having tarantulas walk all
That's
over
my
them.
pet now.
Yeah, we know that's never gonna happen. The idea is to get them to the point where they're more comfortable. And then that's it. They might stand right over here and that's the best they could ever do. And say, okay, I'm comfortable here, but no further, and that's it. But that's still better than way over there, seeing it and screaming, running down the hall, pushing people out of the way. So that's the sort of desensitization that could come with airplane travel.
Okay,
But
like my mom, she can't look at birds on the wire. She is terrified of birds.
okay,
Like to look, like she can't even look at it.
she's afraid of wires.
I don't know.
Or she's afraid of birds.
She can't look at it on a book. Like if we driving, she freaks out. If we driving like if she see it, she freaks out so bad, like, oh my God, so like it's bad.
Yeah,
Birds on the wire.
yeah, that's unusual.
That reminds me of crows that,
I don't know how to fix that.
Yeah,
She would have to
There's
speak
nothing
to
the
somebody
person
about
with
that.
her either.
Microphobia, fear of small things, probably makes sense, right?
Yeah.
Triskaidekaphobia.
What's that what?
Afraid of tortoises?
Triskaidekaphobia.
Can you say it again?
Triskaidekaphobia. Fear of the number 13.
Oh, interesting. I definitely fear the number 13.
Fear of the number
There's
13.
nothing possible
Friday
about that number.
13.
I hate when elevators have a 13th floor. Why would it be 13th floor?
Businesses or whatever
What?
don't have a 13th floor.
My
There are people
old
that
apartment in
just
Chicago
skip the 13th
did
floor.
not, it was built in the 1920s, it had a 13th floor. If you look at the elevator, it went 10, 11, 12, 14, 15, 16, 17.
The 13th floor.
Because they knew that people were suspicious and, or suspicious, no, superstitious, I'm sorry. Superstitious. So they would never want to live there, so they would never buy a unit on the 13th floor, so they would sell less of them. A lot of airplanes wouldn't have a 13th row on their plane because people wouldn't buy a ticket for that seat.
Really?
Really?
I was born on the 13th. Wait a minute.
Oh gosh.
Was
Ever
it
fall on
Friday?
Friday the 13th?
No, it was Wednesday.
Okay.
But
You
my
remember?
birthday been on Friday the 13th.
Oh,
sure it
gosh.
was, yeah. Couple of times.
Wait.
I thought it was the number 6.
But, yeah, Friday, it's not based around Friday the 13th.
That movie was based on the fear, right?
Originally, it was based around biblical number of the devil. Because a lot of people think that 666 was the number of the beast.
Yeah, that's what I said. I was scared of number 6.
Actually, that's a misinterpretation. It was originally 616.
Oh, really?
And of course, if you add that up, it becomes
13.
13.
Oh.
Yeah.
Whoa,
okay.
okay. You just blew my mind.
Yeah.
I was scared of the number 6.
Yeah, like I don't like seeing too many 6s on something.
My boyfriend's number is
Or like a
366.
license plate, like
Oh,
I'm
yeah,
driving,
yeah.
the license plate got a lot of 6s when I'm like, we getting the next lane.
Taxis, a lot of
Crazy.
times are like call
I-
225 666
I am scared of number 6.
Yeah, when
I don't
was
trust
younger,
taxis
they
for that
told us,
reason.
like, you told us, well,
Yeah, I'm like 6. I'm not taking it this one.
Nope.
No.
So, as I said, for pretty much everything on the planet, somebody has a fear of it somewhere. Okay, obsessive compulsive disorder. Have you heard of this?
Yes.
I know you have. People misuse this all the time.
Okay, OCD.
I know, because they clean.
Yeah, exactly, because they're clean people, they suddenly have obsessive compulsive disorder. No, obsessive compulsive disorder usually has to do with having to do something, or see something or touch something a certain number of times, and because there's usually a number associated with it. Like wash their hands 10 times, or check the locks 5 times, or make sure all the chairs are pushed in equal distance to the tables, things like that.
Monkey
That's
has
OCD.
OCD.
You ever watch that? Ever since I was in elementary school, I'm not sure it would be OCD, but I have a tendency where I have to change rooms around, like down to the dresser to the bed, like I change them around, like I say I change my room around at least 3 times a month. And it's been going on since I was in elementary school.
Don't you run out of options
And then
after
Yeah,
a
that's
while?
what I was gonna say.
I changed the living room around. It's just been a habit. I can't help it.
I
I
changed
try
mine
to
around
help
a
it.
lot.
I even try to help it. I said one month I didn't want to do nothing. I will buy one thing and I will change my whole room around. Or I will straighten up and I will change my whole room around. And it's been going on since elementary school.
My aunt was like,
I know your mom loved you, girl.
So,
You're clean.
the good thing about that is, for the most part, it's not really distracting from life.
No, not at
So
all.
the problem
But
with OCD behaviors is oftentimes they distract from life. The person has to do something a certain number of times, and they can't leave the house until that's done. And that's when it becomes difficult.
You ever watch Mom?
But, yeah, of course.
He has OCD.
That's a good example.
yeah, he definitely had real bills.
So do you have OCD?
Yes, he does.
Because I see you tap, like you have to tap your cup on the table at least like 3 times a day. I see you like just dragging it. And then you come over here and you drag
It's one thing though if he taps it and then sips, taps and then sips.
That's just like everybody loves Raymond. His
I
was the
do.
cereal. Ray's was the cereal.
I do
So
push
he had to put
chairs
the
in.
cereal on his chin before
So-
he eat it.
Don't we all have
Every
those
time.
tendencies?
Like
And
even
I
if
see
I'm walking
you,
through
like-
a restaurant and chairs aren't pushed in, I'll walk over, so I'm walking past, I'll push it, and I will like go out my way.
I do that in clothing stores, when I see the hanger sticking out and the shirt is on the hanger, I'll put it on the hanger.
Yeah, so is the world gonna end if you don't do that?
No.
But do you feel better
Yeah.
if you do?
Yeah,
Feels
So
like
that's kind of
we're
what it is, so it doesn't interfere with life.
I just hate lights.
Obsessive compulsive disorder is interesting, I mean, the idea of obsessive compulsive disorder is this need to count things, been around for a while, or make note of things, or make sure things are a certain way. This is something that's been around, documented for a long time. Okay, let's talk about, vampires. Well, we know that vampires are not real,
They
right?
not?
They're
I
not.
love vampires.
They are not. What do we know about vampires? Other than they're not real, what do we know? They suck blood, what else?
Have fangs,
They have
sometimes turn into bats.
They like
Turn
the
to
nighttime.
bats, they can't see the reflection,
They count.
then
They're
why do
bad. They burn in the daytime.
okay, they burn in the
sunlight.
daytime?
Or they sparkle.
Yep, shimmer, as they say.
Okay,
But I was Team Jacob.
I want that kind
I really
of,
didn't
I
like.
might be that kind of vampire.
they can't go into your house without being invited first, things like that.
Yeah, that's true.
Well, if you look at vampire folklore, it's been around for a long time. If you go back a couple hundred years, Europe, Eastern European vampire folklore, one thing that they would find is that they believe vampires had an obsessive compulsive disorder. In other words, they were compelled to count things, which is why
Count Dracula.
See, I told you I count.
that's different. That's different. That's a title. However, it was believed that this is going back a few hundred years, if people were going out at night and they're gonna go to an area near the woods or someplace that may have had vampires, they would carry in their pocket a handful of uncooked rice or a little bit of salt. So that if they were being chased by a vampire, they would throw it down behind them. The vampire was compelled to stop and count every grain of salt or every grain of rice,
Oh my god.
which would give the person time to get away.
No, that's so stupid. That's even worse than, that's stupid. That's so dumb. Are you serious?
Yeah, you never heard that story?
So,
No, that's dumb. That's even
I've heard
worse.
something about salt.
so if you go forward
I would rather
into
for
the
vampires be true.
20th century, and you go to a PBS television show called Sesame Street, there was a character on Sesame
Yeah.
Street, a puppet,
Yeah.
that was called the Count. And he was a
Oh,
vampire
oh,
puppet that was compelled to count. So that actually goes back to vampire folklore dating back hundreds of years.
That's funny. That is retarded.
It is funny and retarded, it's not retarded.
It is.
That's why he was called the Count, he was compelled to count things. Oh,
No,
wow.
but I
That's why he liked to do that, because he was a vampire.
I like him.
And yet Count is just a title like queen or prince or king.
But what about
Go to that little portion.
Well, they
I
say
never
he
knew
was a
this
vampire.
cute girls.
Vlad the Impaler. He was just a bad man.
He was just a bad man?
You said who? What'd you say?
Vlad the Impaler.
Well, somebody that portrayed himself as a Batman? I mean,
Well-
as a vampire.
He's a-
Cutting off his enemies' heads, and putting them on stakes. Lining the
I mean, why
streets,
not? If he can do it, hey.
if he could do it. So, now we've learned about vampires and obsessive compulsive disorder. What other phobias are there? I can't think of any. Let's see what's next.
Oh, wow.
Yeah.
Do I have phobias? I'm not afraid of anything.
I'm scared of midgets. Oh yeah, my mom's scared of midgets too.
I'm terrified of midgets.
I'm sorry, y'all.
No human should be that small.
Damn.
There are other things, the next thing coming up is schizophrenia, I don't wanna get to that just yet, because I wanna include some other mental health, topics
Yes.
that are not on the screen, or not in these,
You
in these
wrote
short little notes.
You
I
didn't write
write
these.
this,
Oh,
I wrote
alright.
my own.
Oh, alright.
It's false sense
So-
of grandeur and mental.
Sierra the Panther.
Grandiose delusions.
Grandiose delusion. Oh, that's what it's called.
No, cause I know what.
Delusions of grandeur, either one. You could, it's either grandiose delusions or delusions of grandeur, however you wanna say it. It means the same thing, the person has this elevated belief in themselves, like they are better than everyone, that they're godlike.
Arrogance?
Not just arrogance, no, it's
Hey, what?
beyond arrogance. Good
So
example, yeah, somebody who believes that they're just more like a god than a human.
Narcissistic?
It's beyond narcissism,
What's
narcissistic.
the word again?
Narcissistic just means that a person believes that they are a human better than other humans. Grandiose delusions means that they are elevated to another level.
Oh, yeah.
Like
Sure.
enlightenment, more of an enlightenment.
Oh, like they think of themselves as like a god?
Like God, like superhuman, like not a human.
Oh,
Whereas narcissists believe they're human, they just believe that they're a better human.
Other regular.
Let's talk about what?
Eating disorders.
Eating disorders.
Have you heard of anorexia nervosa?
Yeah.
And you're actually together?
No, anorexia nervosa.
Yeah.
Not anorexia.
The versa?
You
Yeah.
said that before.
Anorexia.
You told us about this before.
Anorexia is just a decreased appetite, right? Anorexia nervosa,
It's
Not a
condition.
that's where she thinks she's fat but looks like this,
Oh my
intentionally
God.
doesn't eat. That's different from bulimia how?
Bulimics wanna eat.
They
Yeah,
throw
like
up.
food. Well, they binge and purge.
They
It's not
do
always
eat, but they
throwing up.
throw it up.
It's not always throwing
Oh,
up.
take
Yeah, because I was saying,
Sometimes
Could
it's
be
laxatives.
excessive exercise.
Oh.
Sometimes it's excessive exercise. Sometimes they binge one day and they don't eat it all the next day. So they binge and purge. They overdo it and then they overdo it.
The next one is which one?
And
That's
then-
bulimia.
That's bulimia.
Oh yeah, I can see how that, especially if you had they were small, you can't be fat.
Well, in bulimics, also, they're hard to spot because they're usually within normal weight limits. Patients with anorexia nervosa, it's pretty easy to spot.
The thing I don't understand about
Okay, like the
bulimia is if
Olsen's
if they enjoy eating and they are okay with their body being within normal weight limits, then why is it a
Yeah, what
thing?
are they doing? That is.
Because they'll eat,
Like, what is
they'll eat
their,
all 6 of those donuts.
yeah, but what is their,
So just one.
desired outcome?
Their desired outcome is to enjoy food without
The consequences of
Getting
enjoying
fat.
food?
Oh, like what? So,
Yeah.
tell me that.
So they're trying to
You
make
hear about that thing, the challenge that was going on with skinny women and collarbone? They put the
Yeah.
fish right there on the collarbone and fish swim fish.
And you
Yes.
Where the knife
They're
out.
leeches. It's not fish, it's leeches.
No, they were fish to see how deep their collarbone was, to see how skinny it was. They was leeches, the leeches was gonna stick right there on them and start
Yeah,
sucking.
that's what they just said.
That's weird, I had not heard of that.
No, it was just a fish to show the size.
So anorexia,
And
was what's
The
the
depth
term?
of the depth.
Anorexia nervosa,
Anorexia
That's-
nervosa, that would be like,
that's
The
the
Olsen
mental
twins.
disorder. Yeah,
ew.
yeah,
Olsen
they had,
twins were
they had
anorexic?
an eating disorder at one time.
Yeah,
Oh,
they
they were?
did.
Yeah, it was pretty well publicized, I'm not releasing any
Oh, you know
information
what?
that the world didn't know, so,
I think I know which one.
yes.
Yvonne, how can we enjoy food without gaining weight?
Oh, yeah.
That's
right.
That's what the bulimics do.
Oh,
I thought you had a kid.
What's this thing, is this food that people get put in these things, like, school eat that appetite?
It's more of a band, yeah, that decreases the size of the stomach, not the abdomen.
No, that's
Stomach.
something, you know.
How
And
does the
that
band
way,
decrease?
less food goes in. In other words, every one of us has a set point that says we're full, every one of us. The stomach stretches to a certain point, that sends two signals. There's an electrical signal, there's a hormonal signal, chemical signal. Those two things are what sends the message to the brain that says you're full. It actually takes about 20 minutes to get to that point too. So this is why people are sitting down munching on chips mindlessly while watching a game or watching a movie or something. They won't feel full because they haven't had the opportunity to even consider it yet. Their body hasn't gotten to that point where it says, okay, you're full, stop eating. So what happens is every one of us has a point where our stomach gets to a certain stretch and says, okay, that's it, don't eat anymore. The problem is if you keep eating past that point, then over time, there's a new switch, a new number that says, okay, now this is the full point. And then over time, continue eating that much, then there's a new number that says, okay, now you're full. And the problem is, when you start eating less, because people try to diet or whatever, so they start eating less food, they still feel hungry. And when they still feel hungry, they just want to eat, which is why it's difficult to do that. But if you start eating smaller and smaller portions, it'll take about a week. If you cut your portions in half right now, whatever you're eating all day today, you literally cut it in half. Eat half of that bag of chips that you should be eating anyway. Eat half of that, whatever you're gonna have for lunch. If you cut all that in half, you're gonna be going, oh my God, I'm still so hungry. But it's okay, because you've still gotten enough nutrients for the day.
but it does make
But your body.
What'll happen is, over about a week's time, your stomach will get back to this point where the new set will say, okay, now this will say you're full. So now, eating half of what you did before is now enough to satisfy you. But that takes time, and a lot of times people people just don't stop eating. They don't give, they give in to their hunger, and they say, oh, I'm just gonna eat because I'm hungry.
That hurt. It hurt my heart to not eat.
Ironically, just the opposite,
Um,
because it's healthier for your heart to eat smaller portions and less food.
I get hunger pains, right? And they be so bad that they really hurt my heart.
No, it won't hurt your heart. Your heart's not dependent on it. Now, that's different from having low blood sugar.
So what, oh yeah, so what, the hunger pains? Where do they come from?
It's not,
It's not really hunger pains?
no,
It's not?
it's not. You're not hungry enough to be in pain.
I do,
You're not.
I do.
You're not.
So what's
No,
that?
those pains will come after a couple of days of not eating.
What is the
After
feeling
3
of my
days not
tummy is
eating, then
rumbling?
you'll actually start cramping up and feeling pain.
I get nauseous and I get pain.
I get dizzy.
Okay. But the problem is, when you get nauseated and you get pain, as you're saying, from not eating, then what do?
I eat
Okay, what do you eat?
food,
Okay, what food do you eat?
I mean, whatever.
Yeah, do you eat an apple?
I'm allergic to
No.
apples.
Do you eat pears?
like oranges.
I'm allergic to pears.
Do you eat
Pineapples, yes.
fresh vegetables?
Yes. I eat. If it's in there, yeah.
No, not if it's dinner,
If it's in there,
if it's in there.
Yeah.
Yeah,
but I do eat, like, food.
I know, but you're eating the wrong foods, you're eating too much of it. Because when you're hungry like that and you want to eat something, you can certainly get something healthy and eat that. If you're gonna get a sandwich from Subway, do you get the 6-inch or the foot long?
I get sick.
Okay, because you're hungry, you get the 6-inch, do you get chips with it?
You know it, it's a combo, I'm hungry.
Yeah.
Okay, I'm asking, listen, I'm not judging anybody, I'm asking for honest answers.
Yeah.
Because I wanna give you honest answers in return.
Right.
So if you're hungry, you say, okay, oh my God, I'm hungry, I have to eat right now. Go to Subway and get a sandwich that's 6 inches, cut it in half, and eat half of that sandwich.
Mhm.
And eat half of those bag of chips and save them for dinner for later on. So when you're hungry again, you don't have to eat all of that at once, is what I'm saying.
Okay.
If you're getting the foot long, cut it in half. You don't need the foot long right now, eat the 6 inch right now.
That's crazy, I'm hungry.
See, when I
And that's the problem, because people think I'm hungry, so I'm supposed to eat until I'm completely full.
Yeah,
And
like
that's
your eyes are
wrong.
bigger than your stomach.
That's where, well, that's anatomically inaccurate, but I know what you're saying. But that's the problem. The problem is people think, well, I'm hungry, so I have to eat as much as possible until I'm full again. And you don't have to. You can eat a little bit, and that will be enough. It'll be enough for your body. It might not be enough to satisfy your hunger, but what I'm saying is that will change over time. If you change the way you eat, that will change over time to where it will be enough to satisfy your hunger, yes.
So, can you explain the tummy rumbling feeling?
Most of the time, a tummy rumbling is not from hunger, it's from gas, emptiness
Yes.
moving through,
Oh,
gas and
emptiness.
fluids moving through the intestines.
So
You know,
does
people
that
say,
not
"Oh,
give a
hungry,"
signal to say
It doesn't
eat?
necessarily mean they're rumbling because they're hungry, it just means there's emptiness in there.
Like when you have an
So yes, by eating, you're gonna put things in there, so it'll stop the rumbling, that is true to an extent. But most of the time, that's what you hear, that word weirdness. It's not like hunger. Yes.
I seen this thing that said every time this isn't true. It said every time you eat, you either helping your disease or you fighting it. Is that true?
What disease?
They saying like basically your overall health, like every time you eat
I got
something,
you, yeah.
are you fighting your disease with what you eat, or you add to it, like basically like you.
That's an interesting way of putting it, because everything we put in our body has side effects. This is true, we know this.
Yeah.
And the reason that we eat is not because something tastes good. The reason we eat is to get the nutrients. So, in a sense, that's a powerful way of putting it, because yeah, you're either putting something, you're eating, put something in your body that's going to benefit you, it's going to be helpful, or it's going to be harmful. Now, there is a possibility that it can do both, absolutely, and there's much of the time, most everything we eat will do both. That it's going to put some good stuff in, some bad stuff in. It's going to make things better, it's going to make stuff worse. So the idea is to put in as much stuff that's going to make the good stuff happen, and less of the bad stuff. So it's a powerful statement. I kind of like it. It's a little bit over the top, but I like a little bit over
But
the
it
top
said
sometimes.
Every
over
time
dramatic.
it was a thing. It said every time you eat, you either helping your disease or you fighting it. And now, ever since I read
You're
that,
either
I've been
extending
acting
your
so
life or you're
weird.
killing
Yeah,
yourself.
like
Yeah.
not like you got a disease and
Right.
you get and like basically like you got cancer, you just ate a burger, now you get more. Like it's just basically saying like every time like you
Everything
guys want to
you
make
eat.
yourself sicker or healthier.
Yeah.
And that's why I've been real weird with food now. Like I'm like, yeah, because I might get a disease and
That's a
might
powerful
get-
statement. I like that.
It changed me a lot, and I told you that. That changed me a lot. That's why I'm being here acting crazy.
I'm always just telling me to drink water before.
I binge one day, like 2 days.
Then it'll make me eat less. And then drink a bottle of water afterwards and it'll make you fuller.
Yes, and especially if you add some fiber in there or protein in there as well, fiber and protein with that water. Yes,
So like.
because it just gives a feeling of fullness.
Yeah.
Which is fine, because you're also then going to be hydrated. But the biggest problem people have that I see when it comes to eating is that they eat. Oh, they overeat, first of all. They eat bigger portions than they're supposed to. And
they
then
drink the soda.
they eat a lot, yeah, and they put a lot of sugar in that they don't need, like the soda. So
So what if we ate half of the
But what's
portion?
a portion?
Half
I
of the
mean,
bag of chips and then a soda.
right here.
that would be better than what most people would do. Most people would eat the whole cookie, the whole sandwich, the whole chips, and drink a soda. What I'm saying is, and by the way, you'll never ever hear me say, never eat McDonald's or never have French fries or never have a cheeseburger, because that's ridiculous. Of course we want to have those things. I wouldn't want to live in a world without pizza. That'd be miserable. But
Me too.
at the same time, we have to have that balance. So all I'm saying is,
So don't eat the whole box no more, just eat half of the box.
if what you're doing now is eating the whole box, then yes.
Never,
Make those changes, yeah. I never tell anybody, okay, stop eating all crap food, only eat raw vegetables and fruits, and now get on a treadmill for 3 hours. I never say that to anybody, that's not realistic.
You don't really like the treadmill.
I don't like the treadmill, I like the elliptical machine. Much better option, it's less impact on the joints.
How about the weightlifting?
I like lifting weights, yeah,
That's
I
the
do
one
that,
that got me last time.
I did that a lot.
Everybody should lift the weight.
My mom said, eat to live, don't live to eat.
There you go,
My mom always,
she was right, she is right.
she always, fruits and vegetables and shit.
Yes, yeah, yes, don't shake your head no, shake your head yes. Stop
It told
shaking,
me
you're
to
saying
eat.
like, no, no,
Cause she do
she's
it every day.
right.
And then she the reason why I was taking the vitamins every day.
That's
She's
your
a healthy person.
That might be
My
a-
mom just told me that I wasn't breastfed and that
Every
the doctors
time I
told her I
eat
was lactose intolerant, but she said, oh no, she's not. I literally screamed at her, I was like, are you kidding me?
My mom literally judges everything I eat. Like if I eat a burger, she's like, vegetables instead. Like she judges everything.
I like vegetables, but I hate
Everything. I come home with a Snickers. She's like, you don't need to be eating that. Everything.
I'll just open it up.
Y'all make me want to salad.
Yo,
Yeah, that's why I'm here for much day.
Is, that just reminded me though, is lactose intolerance like a thing that can go away? Or is,
Yes,
okay.
yeah,
I've always had some sort of
it's a
sensitivity. but I wasn't
deficiency in the
sure.
enzyme lactase. And you know that's an enzyme because it's an A, lactose is a sugar, it's an O.
That disease thing.
So, people can have a lactose intolerance and then start producing more lactase, and then they have less of a lactose intolerance.
Gotcha.
People can produce some lactase, some of the enzyme, which means they can eat a pizza with cheese on it, but they can't drink a whole big thing of milk. Or people can be perfectly okay with lactose and then later on develop a lactose intolerance because their body just starts making less and less of the enzyme.
Gotcha.
So yeah, that can go.
It's like,
kind of
it's
either
just like
way.
any other allergy.
Well, it's not an allergy though, it's an enzyme deficiency.
Gotcha.
So yeah, the body could start making the enzyme, the body can make less of it, the body could stop making it completely. All right, let's talk about something else.
like,
Oh, I don't know. How about factitious disorders?
whatever that means.
Fake diseases?
Like a hypochondriac?
No. No, these are a little bit different. Something like malingering.
Who?
Malingering.
Malingering?
Oh, you don't know what that is now, but you will see this.
Can you pronounce it one more time?
Ooh, my back hurt. Ooh, my back
Oh
hurt.
my God.
Shh. Hold on. Oh, the pain is
Any kind of
it's
pain?
really bad right now.
Oh, I do that when I get in the hospital, so I can see what
You need a chair?
No, the only thing that seems to help are those Oxycontin.
Oh, yeah.
That's what malingering looks like.
I work in pharmacy.
And they will carry this all the way down the street. They will carry this into the pharmacy with their. I don't know what this is. The doctor gave this to me for pain. He only gave me 30. Can I get like 50?
Nope.
Oh, you can get
They're
some.
faking it. They know why they're faking it. They're faking it for some tangible reward. Sometimes it's very simple. Sometimes it's I'm so sick. But yesterday was even worse. I couldn't even get out of bed, and I missed my exam. And they said I can't take my exam without a doctor's note. So they're faking it. They know why they're faking it. They need to get some sort of tangible reward, something from it. That's different than Munchausen syndrome.
I was gonna say.
Munchausen syndrome is where a person fakes or creates signs and symptoms of a disease, but they don't understand why they're doing it. And this used to be something that they would see in nurses. A nurse would intentionally inject herself with insulin, even though she wasn't diabetic. And of course, now with all that insulin in her blood, they're going to deliver all our sugar to the cells, and of course the storage cells, and then she's going to have low blood sugar, and what's going to happen to her? Pass out. And of course, everybody comes rushing to her side and gets her into her bed and holds her hand and says, it's okay, you're gonna be all right, we're gonna take care of you, blah, blah, blah. Now, she's not doing this for workers' comp. She's not doing this to try to get out of work. She's doing this for the comfort, for that attention that she's been given, that she didn't get back. Now, of course, we know that when the body releases a lot of insulin, there's also another protein that gets co-released with it. But they didn't necessarily know that. And if somebody injects insulin, well, then they don't get that other protein at the same time. So when we check this person's blood, we see their insulin levels are really, really high, but that protein is normal, which means this insulin didn't come from their own pancreas. They injected it into themselves. And if they're not diabetic, now they've just bought a psych consult. You see, a psych consult. Now they're getting a psychiatric consultation.
Cause of why?
Because they're crazy.
You just like
They just
basically
intentionally
making
made themselves sick.
That's
But again, they don't understand why they're doing it. They don't realize why they're doing it. This is Munchausen syndrome. They don't realize why they're doing it. That's different than Munchausen syndrome by proxy. That's where a person makes somebody else sick so that the guardian gets the attention.
That's how the movie.
So this is where mom would intentionally make their kid sick to bring them to the hospital, so then mom gets attention. Not medical attention, comfort.
From who? The doctor?
From the doctors, from the hospital staff.
Family?
Family, yes.
This is anybody.
Yes.
Did she end up killing her? No, didn't she end up killing her?
Yes, she
The
did.
the daughter and the boyfriend ended up killing the mom.
Yes.
That's it.
Oh,
Never heard of that.
It wasn't a movie, it really happened.
So, yeah, this makes really good Lifetime movies. Munchausen syndrome by proxy. But they don't always have to actually make the person sick. She'll get her little 3-year-old daughter and shave her head.
Oh, man.
And when the daughter asks why, she'll say, well, the doctor says you have cancer. So that way, when they're walking through the mall and they run into some old friends or neighbors, they say, what's happening? And the little girl looks up with her puppy dog eyes and says, the doctors say I have cancer. Now, mom's not doing this for fraud. She's not trying to get any money. She's not doing it for anything else other than the attention. But of course, if she's intentionally making her child sick,
It's illegal.
then, well, all of it's illegal, but if she's intentionally making her child sick, it's dangerous. It's more than just illegal. It could be dangerous to the child's health. Could kill the child.
So when you do it to yourself, well, when they do it to themselves, is it illegal? Like when they inject themselves with insulin, is that something that could be considered like?
Not so much illegal,
No.
no. But reason enough to be terminated from their job, they're doing it at work, and reason enough to have a psychiatric evaluation, absolutely. There's even 2 documented cases of Munchausen syndrome by proxy with pets. People made their animals sick. Because a lot of people will tell you their animals like their child, they go to the vet and the vets and the technicians there are just like any other doctors and hospital staff. They want to comfort the family member as well. So that's unfortunate. Let's talk about some identity disorders. How about that?
Yes.
A dissociative disorder, a dissociative identity disorder, is where a person sees themselves like they're watching the whole thing on TV or on a movie screen. They can see themselves do things. In other words, you'll hear about this where the guy will say, it was like I was watching a movie. I watched myself walk into the kitchen. I watched myself get the knife out of the drawer. I watched myself stab my girlfriend 14 times. And I was just sitting there watching and I couldn't control it. I couldn't stop it. I was just watching it take place.
Like an out of body experience.
Sort of. Well, in the most general sense, perhaps, yeah. That's a dissociative disorder. You ever heard of an identity disorder?
Yeah.
In fact, where a person, we used to call it multiple personality disorder. It's a real thing.
Okay.
But typically, people who have that sort of an identity disorder have one other personality in their head, not 17. Although that makes for a good movie, but typically it's not that many, yeah.
So whatever. Cause I asked you about this before, I'm not sure. When a person may get ghost pregnancy, you said that's real, right?
Their body will
Would that be a disorder?
undergo changes as if it's real. But it's not.
Is that a disorder?
Yeah, I don't know where that would fall though.
Oh, okay.
Because the brain is amazing, the way that it can turn things off, switch things on, switch other things on.
Yeah,
They
'cause
call it might be a conversion disorder, might fall into that.
okay. But that is real.
Yeah.
My cousin, she had 2 ghost pregnancies. I don't know if that's the correct term to use, but it was like that. She got big and everything. And then this one night, she was saying she was having contractions. So the whole time we was thinking like she was pregnant, and a baby was never produced, like ever. But in the bed, she stayed the night, and she sleep in my bed, whatever, and she like digging her nails in my skin because she's saying like the contractions hurt so bad.
Mama, you know the one.
We
That's
thought she was
probably
pregnant.
gas.
Hmm.
That's probably gas.
Probably gay. So what would be like her stomach getting big?
That or stomach, or
Her
abdomen.
ankle.
I don't know.
Maybe she's just eating a lot and has a, the quote unquote food baby,
Yeah, I have no
or is
idea.
just gaining a little bit of weight and fluctuating.
Because not her uterus growing.
Oh, wait, can we,
Yeah, she
question-
was stop it.
a question about the 2 personalities, you said you said 2, right?
There's usually one other person.
Okay, so can you give an example of like, what was the other personality, like, general sense of what you would hear more commonly, like the other personality is a nice person or a bad person or a killer?
Could be.
Which is common, or they just might be like, oh,
Have you ever
this
seen
person-
It could be an older person or a younger person.
Oh, it could be an old person?
The other
People
personality
say
can be-
what if more than 2, are they lying?
No, it's just very, very rare.
There's this new show and it's like a real person, but it's not real at all. She said she just so many personalities. And she's 17.
It's very possible, but it's unlikely. But again, that's what makes for good movies. But those are the extreme cases.
So the common cases are dangerous, like where they have 2?
But in fact, most are not. When people even think of schizophrenia, most people with schizophrenia aren't dangerous.
Are they-
But people automatically assume they are because they've seen it in movies.
Yeah, I think that.
And that just isn't
They're
true.
not though.
In the show,
This
in the show,
is
go ahead. I was just making a fun fact. In the show Iron Fist, there's a girl named Mary who has multiple personality disorder, and it's Mary and then Walker. Like her name's Mary Walker, but there's Walker, who's like a more military person, and when Walker comes out, she's more stern and like really straightforward with people and a little
Is this
scary. Huh?
Is this real?
No, it's just in a show. It just gives a more accurate depiction of what you're talking about. Like there's only
I've
one
never
or
seen
the other. Huh?
Oh, like an alter ego.
Yeah,
That's
What
not
if it, when
yeah, it's really
they
good.
just whoever it is, like his ass is talking, but no one else.
The second
That's
season of
like
Iron
a
Fist plays out with Mary and like a whole
Hallucination.
big storyline with Davos and like him taking over. and
A
stuff.
hallucination in and of itself doesn't make it a diagnosis. It's a component of different diagnoses. But that's one of the things that can make up schizophrenia. And with hallucinations, they can see things that aren't there, just as real as I am to you.
Yeah.
Or they can hear things that aren't spoken or sounds that aren't made, which is still considered a hallucination, just an auditory hallucination. So it doesn't just have to be visual. Just generally speaking.
Well, is that how they diagnose schizophrenia?
That
Or
is
that like
one-
the only
That's one component. There are 5 different things, different components of schizophrenia, including delusions. And delusions could be like the delusions of grandeur or paranoid delusions. There is something akin to a comatose state that you may have heard that term before, where if you walk past the person, they're sitting in a chair, looking out the window, and the next hour, they're still sitting there, and the next hour, they're still sitting there, and you walk past, and you move their hand like this, and then walk away, and their arm is still like this. That's two, there's there can be a flat affect, like I said before, where their facial expressions don't match their internal feelings,
Emotions.
like I said. If you can tell them their parents just died, and they're like, oh, okay. Then you can tell them, you know, your bank account's worth $10 million, and they go, oh, okay. When they speak or write, there's often a component of a word salad where they'll just arbitrarily put in words that don't make any sense, or in their writings. And I mean, if you have ever had the chance to read the journal of the schizophrenic patient, it's pretty amazing because they will have words mixed in with arithmetic, mixed in with gibberish, and to them it makes perfect sense, pages and pages of this stuff. And sometimes it's not as obvious, sometimes it's really subtle. I've read stuff before where this guy, I was reading through his notes, he was like a blogger, and like a political blogger, and I'm reading through it, there's like 3 pages worth of his notes. And I read it, and when I got done reading, I'm thinking, I didn't understand what that was about. I'm thinking, this guy must be a lot smarter than me, because I didn't understand a lot of that. Right. So I thought, let me read it again. So I read it again, and I still didn't get it. About the 3rd time I read it, I thought, this guy's crazy. Because then I started to realize that there were things put in to the sentences and between sentences and after paragraphs that were totally out of context. It had nothing to do with previous thoughts or next thoughts or anything. I realized this is just a really subtle schizophrenia word salad. So you can see it in a lot of different ways. So when we take those different components, what you have to see is 2 of those components for, I think, at least a week, maybe 2 weeks. 2 of them, oh, maybe for a month. Like it's either 2 weeks or a month, I kind of forget now, to come up with a diagnosis of schizophrenia. But that's just a classic example, because there's degrees of it as well. But that doesn't mean the person's going to go out and start cutting people up with an axe or anything. And there's a difference between antisocial and there's antisocial personality disorder. You may have heard of that. That does not mean the person's going to go necessarily go after people. We used to call them psychopaths and then sociopaths. The antisocial personality disorder. What the reality is, psychopaths or sociopaths. Psychopaths are born that way. Whereas an antisocial personality disorder, a sociopath, they're born created as a result of their environment. But they both fall into the same idea of they don't follow the rules of society, which is why they can kill people and it doesn't consider.
Have no remorse.
Yeah, look at remorse.
So back to hallucination, right? Would a pastor, you know how they say, like God is speaking to